performed across the country. And on the cover of this month's issue of Neurosurgery, joining us is neurosurgeon Dr. Vijay Yannamadala. And this past fall was the first in the Northeast to perform awake spinal fusion. He's with Hartford Healthcare, Milford Health Center, and Spine Wellness Center in Westport. Doctor, welcome.
Thank you very much for having me.
Well, congratulations on your feat. So what is awake spinal fusion and its benefits?
So awake spine surgery is spine surgery that is done without general anesthesia. We do spine surgery awake with spinal anesthesia and local nerve block. So this allows patients to actually be awake but lightly sedated for the surgery, very much like you might be for a colonoscopy. As you noted, this is the topic of the most recent issue of Neurosurgery, and recent literature suggests that recovery time is cut in half after awake spine surgery. The more we avoid complications of general anesthesia and improve recovery, the better it is for our patients.
Sounds like a win. All right, tell us about your 82-year-old patient from Waterbury.
Yeah, so Miss Edith Gooch was actually the first patient in the region that we did an awake spinal fusion for. She was 82, suffering from spondylolisthesis, or a slipped vertebra, for a number of years. She tried everything from physical therapy, acupuncture, Reiki, chiropractic care, numerous injections prior to considering surgery. Our goal was to perform the least invasive surgery possible for her that would alleviate her symptoms in a safe and effective manner.
So tell us, was she alert during the surgery?
She was awake, but lightly sedated. So she doesn't actually remember anything from the surgery itself.
Interesting. All right, do you expect a wider application to awake surgeries?
Awake spine surgery is a growing trend nationwide. As you mentioned, it was on the cover story for our most recent issue of Neurosurgery. We have done a number of these awake spinal surgeries now at St. Vincent's Medical Center, and we are really growing that program here. I do see it expanding further in the coming years as we realize its benefits to faster recovery and minimizing risk for our patients of all ages. And we have performed awake surgery for patients all the way from 26 to 84.
Do you have patients who just say, "Doctor, I'm not sure I want to be operated on while I'm awake"?
Yes, and traditional general anesthesia is still an option for all of these patients as well. But what we are seeing is definitely faster recovery and fewer complications from awake surgery when we perform it.
All right, Hartford Healthcare, Dr. Vijay Yannamadala, thank you so much for being with us. Great information.
Thank you very much for having me, and we're very proud to be in Milford and serving the community of New Haven County.